Remember, the content on our show is for information only.
It is not intended to provide medical or other professional advice.
We all know that washing your hands is important. It keeps you from getting sick, stops the spread of germs. This is not really a disputed or controversial fact, and pretty much any doctor, nurse, or any healthcare worker would recommend it. So you would think that the healthcare workers are probably some of the best people at washing their hands, wouldn't you?
I know better.
Yeah, that's probably...
I always wash my hands.
We're not sure if that's actually the case. So today on Placebo, we're going to try and figure out why healthcare workers are so bad at washing their hands. I'm Logan Richards, and this is my sister.
And I'm Kaylin Richards.
Today on Placebo, we look at the data on hand washing.
Ooh, okay.
Okay. So this all started when I saw a news update on a conference that happened recently.
A medical conference?
A medical conference. It was the 43rd annual conference of the Association for Professionals in Infection Control and Epidemiology.
Epidemiology is the spread of disease?
Pretty much, yeah. So I wasn't just looking for the results of this conference.
Okay.
It just happened to come up. But there was a study that caught my eye, because I think we've mentioned it on the show before, that the data and almost kind of now like common knowledge is that healthcare workers are really bad at washing their hands.
Well, I think we maybe mentioned that, I forget which episode it was in, but I think I remember talking about like doctors wearing ties or doctors wearing lab coats that are big like disease vectors because they are not cleaned. And I think hand washing is kind of goes along with that too.
It might have been the hospital design episode. I think we talked about like the placement of hand washing stations and stuff like that. Oh, maybe we did that too. So that could have been it. Anyways, the study that I saw here that caught my attention was called The Hawthorne Effect in Hand Hygiene Compliance Rates.
Okay.
Okay, so hand hygiene is what the research literature calls washing your hands.
That's what they call it at my work too.
Oh, okay.
In the normal healthcare setting.
Well, I guess it's kind of self-explanatory.
Because you might not be washing your hands, you might be using an alcohol sanitizing gel thing.
Yes. So hand hygiene covers any particular way that you are keeping your hands clean. Mm-hmm. So this study was done at the Santa Clara Valley Medical Center between July 2015 and December 2015, so a period of several months. Mm-hmm. I guess we should start. Do you know what the Hawthorne effect is?
No, a meteorological process.
No, it's not that.
It sounds like it would be.
So basically what I found is it's the tendency for someone to change their behavior when they know they're being watched.
Oh, well, okay.
So
that sounds like a psychology kind of thing.
Yeah, I think it is. So it's basically like the reason that businesses put up a fake security camera or a sign that says like, smile, you're on camera, because they're trying to... Yeah, when they don't actually have real cameras, because they're trying to induce the Hawthorne effect, I guess. They're trying to make would-be thieves change their behavior because they know someone is watching. Mm-hmm. Does that make sense? So this study, which as far as I can tell, actually hasn't been published in its full text yet. So that might be
recent data collection.
Right, it's really recent. So it sounds like it was just something that was either like a presentation was given about it or a poster was presented at this conference, and somehow it got a hold in the media, because there were several media outlets reporting on it. It was really interesting. What they found was, well, first I'll tell you how they did the study, and then I'll tell you what they found.
Okay.
They had 5 infection control specialists, it seems like. They call them, in the study, they call them infection preventionists.
Okay.
Okay. And so basically these are infection control nurses. And they have 5 of them in this study, and they're all known to the hospital staff. They all work there regularly. Everyone knows them.
That's their normal job?
And they know that their normal job is infection control.
Okay.
And then they took 15 volunteers that they got, which were unknown to any of the other hospital staff.
So they were just random people coming in to volunteer at the hospital.
Right. And these then volunteers were trained by the infection control nurses on how to properly judge someone's hand washing abilities, I guess. Hand hygiene, both in the type of like when they do it, how long they do it, all those kind of things. And then they made sure that these guys, both the experienced nurses and the volunteers were judging everyone the same way. Okay. So they trained everyone up so that everyone's judging the same way. And then what they did is they...
Inter-rater reliability.
Right, yeah. So they controlled for that.
Okay.
And then what they did is they looked at 4,640 observations of healthcare providers.
Seems like a lot.
Yeah. Well, I think so. I mean, it was several months.
Like 6
and
months,
they had 20 people, so it's probably not too much. I don't know how many hours a day these people were watching doctors and whatnot.
It's hard to pay attention to those things. You get bored, I would think.
This was their only job. They were watching healthcare providers of all disciplines doing their normal workday duties, caring for patients and whatnot. When the nurses were watching, keep in mind, these are the people that all the hospital staff know, and they know that they're probably keeping track of how well they're washing their hands. Mm-hmm. So when the nurses were watching, the rate of compliance, so making sure that someone is doing the hand washing correctly, was 57.42%.
What?
Well, okay.
That's terrible.
We'll talk about this later. But when the volunteers were watching, the people that the employees didn't know, it was even worse. It was 21.94%.
This is terrible.
Right. So there's two issues here. First of all, is those numbers are just awful by themselves. Yes. It doesn't even matter. But second of all, there's a huge difference in the amount of compliance when the people know that the healthcare prevention nurses are watching them versus when they don't know someone's watching. So there's two huge issues here. Is that
maybe when they don't know someone's watching, they may have done it and it wasn't visible to that person.
Well, yes. There are a lot of limitations with this kind of research, which I think we can get into. But let's dig into those issues. Let's say first off that this study was done by the people that work at this hospital, and they were doing it in order to try and improve these numbers, I think. And so
they must have been aware that there was an issue.
It seems like it, but they did mention that they've changed protocol or procedure or whatever and try and make
people,
these things
actually,
better.
You should wash your hands. It's not like a choice.
So I'm really not sure why it was this low at the beginning, and we don't know. We assume that it's better now, probably because of this study. I'm sure there's been a lot of work done, and it's just crazy to me. But the other thing is that, because what we know now, at least from this study and from some others we'll talk about later, is that this Hawthorne effect, where people change their behavior, actually can inflate the numbers. The first point that I want to bring up is that a lot of the data that we have on hand washing, especially in hospitals, seems to be done this way, where they have an observer counting basically the number of compliant hand washing situations. Let's switch to a study that used a little bit more of a high-tech approach and tried to take out that bias while they were still looking into this Hawthorne effect. So let's switch to a study that was done in 2014 in Canada at McMaster University.
I've heard of that one. It just sounds so fancy, McMaster.
Where everyone graduates a master.
They only do master's degrees.
Yeah, maybe they only do master's degrees. So what they found at McMaster University, they thought of a different way to try and track hand washing compliance. So what they did was they gave basically what amounts to a RFID tag. Do you know what that means? Radio frequency
ID.
I think so. Hopefully, we'll leave it at that because it doesn't really matter. What it means is that electronically they're like proximity sensors. So if a healthcare worker wearing this RFID tag gets close enough to a hand washing station, then it tracks it. And so then they also put computing kind of electronic tracking systems on all the alcohol-based, sanitization stations.
There's like one every 3 feet.
And, they took one unit, so it wasn't the whole hospital.
Okay.
So they had electronic trackers on all the sanitization stations, all the hand washing stations in the soap dispenser, and in everyone's tags. And so then...
Like on their name badge.
Yes. And so they did monitoring for 4 months where they didn't tell anyone what they were monitoring. They just gave out the new name badges. Anyway, so they ran this for several months before they told anyone to get kind of baseline data. And then what they did is they said, we're going to have auditors, or basically the same thing as people coming in to watch your hand washing compliance. And they stationed them at specific spots in the unit. And it was all set up so that certain stations could be seen by the auditors and certain stations couldn't. So like they weren't looking into patient rooms. They could only see the gel stations in the hallway, basically. The way that they measured things, because of I think the whole setup that they had, they couldn't exactly see who was using the gel, let's say. So because it sounded like not everybody had these fancy RFID tags, and then the gel things were recording any use, so it could have...
And what if it was a family member that came up and used it?
It could have been anyone.
Yeah.
It could have been anyone.
They don't really
But interestingly enough, the effect that they found was that when the auditor was in a hallway and could see a certain gel station or hand washing station, that station was used 3 times as much as when the auditor was somewhere else.
I want to show that I'm doing my work. I'm doing it. Right? I promise.
So basically what they found is the same thing, is that when the employees know that they're being monitored for hand washing compliance, the number... And then, of course, this study was only tracking basically uses of the hand sanitizer. So there's still a little bit of a gray area there. It's not perfect, but what they found was that the hand sanitizer was used 3 times as much when this infection control auditor was able to see the hand sanitizer.
Because if I know someone is monitoring it, I don't want them to think I didn't do it, even though I did.
Right. So this is the Hawthorne effect.
So I want to be sure. I want to be sure that they see that I did do it. So I'm going to use the one and walk right by them, rubbing my hands together.
Okay. So I don't really know what to think about the Hawthorne effect. Wait!
I had a question about the study.
Okay, yeah.
Did they say what their numbers were as far as compliance with hand hygiene, or they couldn't really tell that?
What they decided is that the data that they took and the way that they took it didn't let them calculate a very good compliance rate, so they just went ahead and didn't do it. And all they could say was that the number of times that the hand sanitizer or washing station was used increased about 3 times the amount.
When there was someone watching.
Right.
Yeah. So they figured that they had better compliance when someone was physically watching.
Right.
Because there was just more usage.
Right.
Yeah.
So I think these studies prove, without actually saying it, is that the Hawthorne effect is something that hospitals should be using and taking seriously to help increase the amount of times their employees are washing their hands.
Maybe a good use of your volunteers.
Right? So 3 times as much of gel use, and what was the other one? Like almost 30% increase in compliance rates.
Yeah.
It seems like they should be very obvious about, we're watching you and these numbers actually matter, like set up some kind of incentive. I am really interested to know what certain hospitals are doing to improve this problem, which seems like almost a common knowledge problem now. Healthcare workers don't seem to be good at washing their hands for some reason.
Don't understand why, though.
It doesn't make any sense to me either. So we'll look at one thing. I found one study that tries to figure this out.
It's very easy to use, like hand sanitizer.
It doesn't make any sense.
And I will say it builds up on your hands after all and feels super gross.
Right, okay.
So then I will wash my hands with soap and water in between every so often, because I can't just use Purell or whatever.
I think we can take a look at the limitations of these types of studies. So it seems like the electronic way of monitoring isn't perfect right now. We don't know who's actually using them. We don't know if they're being compliant with the way. I guess I should mention all of these studies use compliance that's made up by the World Health Organization, so the WHO. They legitimately have a 270-page book on guidelines for hand washing.
I think they're trying too hard, maybe. Is this the problem?
Well, it covers a lot of different situations, like, normal healthcare, but also like surgical procedure, and so there's a lot of different things.
Just wash your hands.
Basically,
1 page, done.
There's no controversy on how important hand washing is, and all the money it could save for the amount of hospital-acquired infections that not hand washing causes, all the lives that could be saved. I saw from various papers that the number kind of ranges, but it's millions of dollars that they attribute just to the kind of calculation they can do of hospital-acquired infections that are hand-washing related. Millions of dollars spent on that, and tens of thousands of lives that are possibly lost to infection type of things that come about because of this. So it's a major issue.
I almost wonder, like in our episode on Joseph Lister, We talked about how he was made fun of a lot when he first started talking about that he thought that...
Do you want to hear about... Oh, keep going.
Oh, that he's an invisible... it was invisible bacteria or whatever that was causing infection. And people just kind of made fun of him because they thought that was just ridiculous. Why would something invisible be a problem? And I wonder... I mean, people do not doubt that bacteria are causing infection today.
Yeah.
But, again, they're still invisible. And I think it's hard for humans to...
visualize that?
Keep in mind some things that you can't see in front of you.
Okay, well, you're onto something here. My first question is, I forget how...
So they don't feel as bad as they should,
maybe,
I think.
yeah, outside, out of mind kind of thing.
Right.
So...
I feel bad, but that's just me.
When was Dr. Lister doing his stuff? I forget.
Oh, it was like the late 1800s, early 1900s.
Okay. Well, here's something interesting. So the first doctor that's kind of known as the guy who created hand washing, his name is Ignaz Semmelweis.
Is he German? He's a great name.
He's Hungarian.
Hungarian.
And so, but he had kind of the same thing. He was like, why are all these, I think he worked in a maternity ward, and he was doing these comparisons between like a midwife ward and one with doctors. He was trying to figure out why people were getting basically what today we would call sepsis. And
what time was he working?
He was working in 1846.
So just a little earlier than Lister.
So he eventually, after a bunch of like random things that he thought might be the issue, like he was like, well, these guys, it's
bad air.
Well, he was like, maybe it's laying on your back versus laying on your side.
Oh, I thought you were going to say lay on your stomach. Like, you can't lay on your stomach when you're pregnant.
Anyways, what he found out is that they could reduce this number of infection basically by washing your hands. And so he suggested washing your hands with like a chlorine or some type of strong chemical, not soap. He was having doctors like wash their hands with like this super strong chemical.
So just like dissolve their hands right off.
It was chlorine.
Good. So he was having them kill themselves slowly.
And yeah, well, unfortunately and ironically for this Semmelweis, he ended up in an insane asylum, perhaps because of I don't know if it's because
chemical use.
Who knows? But everyone kind of thought he was crazy, and he kind of increased rates of hand washing for a while, and then after he died, he died kind of in this...
Probably people lost faith in him when he...
Right, and he died in an insane asylum, so people probably thought he was crazy and thought the idea was crazy. I think, it's possible that origin of hand washing being invented by this, thought to be crazy person... it's not unreasonable to assume that's why there's all this, even though there's...
People don't know about that, but I feel like it's still related. Like, well, it just can, if you don't, you have to believe in your microbiology.
Okay, so here's something to that out of sight, out of mind thing that I found.
And that's human nature, I feel like.
Yeah. So another thing that I found that a hospital reported worked to get people to increase the amount of time they wash their hands.
Black lights.
Is that...
Black lights.
No, I don't think you could do that in a hospital.
Yeah. Okay, so gross.
I forget the details of this study. I'm going to have to go back to it. But I did read about a study that put up pictures of... They took surfaces that were nearby to the hand sanitizing stations. They did a swab of them and then grew the bacteria in an agar, like how you used to do in...
A little Petri dish.
Yeah. And they grew that bacteria, took pictures of it, and then posted above the thing, like, this is what's growing on the counter, just down there.
You don't want that in your hand.
Yeah. So then
this counter right here.
They found that greatly improved the number of...
It makes it more visual to people.
Right? So I think you're onto something there. So let's switch to... The question I really want to know is, like, why are people so bad? Like, I think that this Hawthorne effect thing is interesting, but why are the numbers so bad, even with the Hawthorne effect?
I really
why are they like 60% or somewhere in that range?
I feel like ever since I started working in healthcare, that's like the first thing that you are taught.
Yeah, and that's what I was thinking. Okay.
And that's what I've always... So I don't know why people don't do it.
All the practicals that I've had in school, like anytime where we're being tested on working with an actor or a fake patient, basically, to make sure we know a technique.
Yeah.
One of the things that you can do to automatically fail that practical and not even get to perform the technique is to not wash your hands in the view of the patient. Like, if you don't come in the room and gel your hands and be rubbing them in front of the patient.
I'm always rubbing them as I go into the room.
They'll just instantly fail you. They say, you know what, you might know this, but you're going to need to come back and redo it later.
Yeah.
And you can, and for the same time, any time that you're, using some type of device, if you don't clearly clean it in front of the patient, you're going to fail that thing. If you don't wipe the bed down, you're going to fail.
Yeah.
There's like obvious stuff like that. Like, how does it even get in people's heads that maybe they don't need to do that?
Do they forget?
I don't know. I mean, did
they just forget to do it?
People do forget. I mean,
but it's such a habit. I do it like just automatically. Sometimes I do it twice just because I've forgotten.
Let's get into a study that
I walked close by the dispenser.
Was done at the University of Pennsylvania and a collaboration between the University of Pennsylvania and the University of North Carolina at Chapel Hill. Mm-hmm. So this is not particularly about hand washing in healthcare, but they use that situation as a case study to prove a larger point. So this is called The Impact of Time at Work and Time Off from Work on Rule Compliance, the case of hand hygiene in healthcare. So basically...
So if you're on vacation a lot, you don't do well?
No, you do better, actually.
Okay.
So what they did, and we've already kind of talked about the limitations of this, but they took data from a company that basically puts RFID chips into people's badges, healthcare workers' badges, and all the hand washing areas, so gel stations and sinks and whatnot.
Soap dispenser.
Right. So they can tell when people are washing their hands, who they are, and when they do it. And this company has their technology in what it sounds like is 37 hospitals across the country.
Okay.
So they have a ton of data. Basically, this is a social science study. They're looking at the effect of fatigue on complying with safety rules, basically. So what they found is that the longer you have been on a shift, and they say that, typical for a lot of healthcare workers can be up to 12 hours. The longer you've been on a shift, the worse compliance you have washing your hands.
So see, my shift is only 8 hours.
Well, see, that's part of it. So they did a graph here of an average compliance rate over the amount of time you've been on your shift. Is that it starts up here at 42.6%, which again, not great, but that seems to be like the average, which is weird. But
really bad.
So right at the start, and then as you work for about 4 to 5 hours, well, for the first 2 to 3 hours, you get worse and worse and worse.
What?
And you get down to like 37% or so. And then you take a break and you get better. And you get up to like 39%. And then
Who are these people that are only cleaning their hands a third of the time?
This is an average over 37 hospitals nationwide.
This is terrible. This is disgraceful.
And the thing is, most of this time...
It's not hard to do.
All they're measuring is that you're washing your hands when you go into a room and when you go out of a room.
There's a lot of other times when you should be doing it, though.
They're not getting all the other times. So because most of these studies, they need to be almost as simple as possible.
What about when you help someone, wipe after they go into the bathroom? Or...
Right. So there's a whole other protocol for if your hands are soiled, as they say, like visibly dirty. So, and a lot of these studies aren't even measuring that. Although, as you've mentioned, without a sight, out of mind, I would imagine the compliance rate with that is much
If you
greater.
have some body fluids on your hands, you're probably more likely to clean
I would
them.
think that's almost 100%. But as we can see...
Maybe it's not.
It's a lot harder to measure that, though, because a lot of times the auditors, these people that are watching, aren't looking into patient rooms.
No, they'd have to be like in the room
which
watching.
is where that happens. And then a lot of these electronic sensors don't really know if you're doing that or not, because that's not how they're set up to measure.
Right.
So I think that it's probably a safer bet that compliance rate is much higher. But what we're talking about here is this simple compliance rate of you maybe not even touching the patient, but just touching surfaces near them. And it's your hands being clean, both when you come into the room as well as you cleaning your hands when you leave the room. So that's mostly what they're measuring. Basically what they found is that throughout the day, a 12-hour shift, let's say, their average went from 42% to 34% compliance. And that...
My face is shocked.
It's pretty wild, right?
It's pretty terrible.
But they also found that...
This makes me never want to go into a hospital again.
Besides, you have to go there on Monday.
Yeah.
So they also found, though, that there was these jumps. What they think is that they found with the breaks, the compliance would kind of shoot back up a couple of percentage points.
Because they got tired and then they remembered that they should be washing their hands?
Right, so they think that fatigue is kind of an issue here, but also
they had a cup of coffee
workplace stress and stuff. So another thing that they found that was interesting was that the time between shifts, so like say you had a couple of days off, you're going to come back with a higher compliance rate than maybe if you had just started with like 12 hours off between your shifts. Does that make sense? Basically what they found is that over a 12-hour shift, there's about, on average, an 8% decrease in compliance of hand washing entering and exiting a room.
Weird.
On the average, over several hospitals.
It's really weird.
So, and then, of course, they go on to mention the huge impacts of this that we've already talked about, the cost of hospital-acquired infections that these are likely helping to spread, and all the lives that could have been saved, stuff like that. This is kind of just a depressing topic, isn't it?
I'm shocked.
I had no idea it was this bad. Like, everyone kind of thinks that it's bad, but so I think that
as a patient, I would make sure that you do request that your healthcare providers are washing their hands when they come in. If you don't see them do it, because it's your health at risk, or if you're there with a family member.
It would seem that it's more than appropriate to ask, have you washed your hands and can you wash them in front of me? I did see a study where this was done
People should not be offended because they should be doing it.
Right. In South Korea, they did a study that I don't remember the exact details of, but the gist of it was they were asking people, I think it was a survey, whether or not you'd feel comfortable asking if your doctor, had you wash your hands? And like they found a large percentage, I think it was in the 80s, said, yeah, I would ask my doctor that. But then they asked doctors and nurses, how do you feel about that? And a lot of them were kind of like upset by the question and felt that they would feel like undermined, or something, because if people were asking that. So I wonder if there's an attitude too about that.
If they're not doing it visibly, though, they've got nothing to talk about.
So in the end, I think there's probably a lot of ways that hospitals are trying to increase this rate of hand washing. It's well known that you should wash your hands. It's an undisputed fact that it decreases the spread of disease, decreases costs for the healthcare system, improves the healthiness of everyone. But there's still this also well-known fact that healthcare workers are not very good at washing their hands when they should.
I don't understand.
I'm going to post the WHO book on hand washing, which is really long, and you can read it. But they have a whole...
you can.
Yeah. They have a whole section on how you should wash your hands, how long to do it if you're doing it with gel. Happy birthday twice, they say. At least 20 seconds is the recommendation that I was seeing in a lot of things. And that's with soap or water.
Maybe people are washing their hands but not doing it long enough, and that's why the statistics are
so poor. That's the other thing, is that they're all using the WHO guidelines to say whether the compliance rates were good enough. But maybe, the WHO guideline for the alcohol sanitizers is a palm full. So what does that mean? Like, are you just getting a little squirt, or are people actually getting a puddle of hand sanitizer in there?
They changed our machines at my work.
Does it spew out a ton?
Yeah. So they used to have the little gel machines where you would push, and depending on how hard you pushed on the thing, it would be various amounts of gel.
Yeah.
Now they changed it to a kind that's automatic, and you put your hand under it, and it just puts out an amount.
Yeah.
And so you don't have any control. And it's a lot. It's a lot.
Yeah, well, the recommendation is a palmful.
And, maybe my hands are smaller than some other people's, hands. So in my hand, it is a lot of hand sanitizer. But it's probably the appropriate amount. But it takes a while to rub it all in because it's so much.
So it seems like to increase these numbers, it's probably going to take a combination of I think utilizing the Hawthorne effect is actually a great idea. Making it very clear that the hospital is watching you to make sure you're washing your hands right. And then even providing some type of incentive. Maybe we'll give you a free coffee or a pay bonus or something if you have high compliance. But we need to do it in a way. So I think that's a good intervention. But we also need to make sure that we are measuring properly, which it doesn't seem like we have great tools for measuring the compliance rates.
Right.
So it's hard to know whether our numbers are perfect. obviously they're as good as they can be, but it's hard to know what we're missing and what we're not taking into account in these studies too. Like we said, there might be that if you have body fluids on your hand, I'm willing to bet that compliance rate is pretty high.
Yeah, probably not as high as it should be even then, but still.
Probably not. But this is a much bigger problem than I was expecting.
So yeah, I mean, I think we should reiterate, if you are a healthcare worker, please be doing your hand hygiene thoroughly in view of your patients.
And if you're a patient, feel free to ask your healthcare provider if they've washed their hands, because it's your right for your own to protect your own healthcare.
I would say even if they shouldn't be offended, but even if they are offended, it's your healthcare, and that's worth offending someone if you have to, I think.
Right. Basically what we found is the Hawthorne effect works in improving compliance, so maybe all hospitals should be taking that into effect. All hospitals should likely be questioning how they're measuring compliance and doing the very best they can, but also trying to put in any intervention they can think of to improve the rate, because it's likely it's not as high as it should be. It
should be 100%.
Right?
It's not hard to do. And
we know that fatigue has something to do with it based on this one study. And so maybe the longer you've been working, the more reminders you need. Maybe the longer you've been working, the more breaks you need.
Maybe healthcare workers should not be working that long of shift.
Right. So
I'm sure that's one mistake, but there are many other mistakes that probably increase in frequency the longer you're working.
And that's really the only piece of data that I could find that was trying to answer the question, why are we so bad at this?
I like my theory that it's just out of sight, out of mind.
That seems reasonable.
People are busy. They're thinking about there's a lot going on in their mind.
I like the thing where the hospital just grew the cultures of the germs that were growing
Make
right
it visible.
near you and then just posted those pictures.
If you work in infection control in a hospital, I like this idea. Make it visible to people.
So anyways, that's pretty much it.
Put the actual culture up.
Everyone should try and do much better at washing their hands.
Yes. The end.
The end.
Okay.
If you enjoyed the episode, please share us with a friend or two or give us a rating on iTunes.
I've seen some new reviews lately and it's made me so happy. Thank you. Thank you so much. You can visit our website, placebopodcast.com, for our show notes or to send us any suggestions or feedback.
You can also find us on Facebook and reach us there too.
Thank you to James Aiken for our music.
And thank you to everyone for listening. We'll be back next week with a new episode.
Goodbye.
Bye.